when we think about how this behavior develops in that situation, it was very learned, right? And it was just, he had frustration, unmet need, didn't feel successful, maybe wasn't interested, a lot of things. And so when his frustration was expressed and met with, let's take a break and go for a walk, through that trial and error and learning, he learned that a significant tantrum will get me from having to go back to the classroom. And so when any behavior, positive or not negative, is followed by what the individual wants, it is likely to increase. Okay. And we know this in our daily life, and we do this. It's also what we do. So typically as communication and appropriate skills or adaptive skills, social skills, behavioral regulation skills, coping skills, as all those increase, which hopefully there's education going all along the way, problem and challenging behavior, distressing behavior decreases. However, it doesn't always happen. And when it doesn't, we have to look at that more comprehensive assessment, and they may need more individualized treatment to address those concerns. So when we go to figure out the function, the very specific experimental analysis I mentioned with Brian Iwata, we can do those in really intensive clinic settings and treatment settings, and they work for a certain population of individuals, but it doesn't work for everyone. It's not appropriate to put every person through that kind of a rigorous assessment. And sometimes we can actually just interview, and we can figure it out. We can look at the situations. We can talk to a variety of people, including the person who's struggling. And if they are non-speaking or don't have a good communication system, then we rely on their caregivers or the different people across their environments to answer some specific questions, to potentially collect some data, and really looking at, where are these challenges occurring? What situations do they occur and not occur? Do we think we have an idea of what they were seeking, what they were feeling, their level of distress? Are they healthy? Do they feel good? And then how do they respond? Did they get what they want? And does that resolve the behavior? Is there any place the behavior never occurs? All of these things give us information for how to proceed, right? So common things per function, these are just pretty simple. It's not an end-all list. I'm just giving an idea for those who are not as familiar with functional assessment. But if you have an escape motivated behavior, we say typically there's some kind of a demand that's in place or implied. So the child I was talking about who didn't want to go in the classroom, either a demand was placed in the classroom that he did not want to do, was not comfortable with, or even later when he approached the classroom because he knew the demand was implied, it was coming. So then it kept starting later. I have had many school-age children who get to the point where they won't even go to school. So that is an escape motivated behavior that might start for a situation in the classroom and then expands all the way back to I'm not going to school. Tangible behavior is typically when they can't ask for or negotiate for what they want or need, when they have the iPad and it's going to get pulled away. Nobody warned them. They didn't have negotiation skills to say, when can I have it back? I need more time. And all of those communication, nuancing, negotiation skills that may not be developed doesn't mean that they don't have those thoughts and feelings and that's what they want. So we really have to understand it's really hard when somebody's always managing your stuff and you feel like you have no say and control and ability to figure out how that's going to be navigated back, even though you have those desires. So it becomes this really challenging situation, and we have to do a lot of teaching around that.